and thinking about high modernism as a really interesting framework to understand how we got to where we are today. And high modernism, which is a couple elements of that are one, it's like a techno utopia, this idea that technology, especially high volume, high level mass technology, can solve society's ills and create a utopia and create a system that is extremely fair for everybody. It comes from this idea we are going to create the perfect system. It's going to be so fair for everyone. It does not come from a place of harm. It comes from a place of trying to help and trying to build something that is really perfect. But unfortunately, we live in a real human world, and the idea of chasing something that is perfect often has unintended consequences. High modernism is really focused and fixated on legibility, the idea that you can see into a system, in many cases in farming or civic design, and be able to completely understand everything that is happening and be able to track and measure every possible thing. And I think this is an element where health and health technology specifically have gone a little bit too far. We start this quest to truly understand and be able to deliver a perfect understanding of exactly every minute of what is happening inside of a clinic, an examination, an emergency room, and that we can create this perfect administration utopia where we have this dashboard that tells us perfectly what is exactly happening everywhere. I think this is a main point where we have gotten caught up, and we have, created a system where everybody is trying their hardest to succeed in what is ultimately a failing exercise of trying to fully understand every last piece of medicine, which we know is a science as well as an art. And some of those things can just not be measured. So thinking about how do we create a balance, we don't want to throw that away and become anarchists, right? But where is like the appropriate level of tracking and legibility and data that we want for our healthcare system moving forward?
So what we could do differently? Well, here's the thing. When you change healthcare, a big industry, some people are going to lose money. There could be that higher premiums, it could be doctors, it could be hospitals, it could be insurance vendors. Somebody is going to lose money. We'll talk about that more. And that causes political pain. Unless you have public support to tell politicians that the pain is going to be worthwhile for the benefit, you're not going to get anywhere. And you need to have political leadership that's smart. So that's what gave us Medicare and Medicaid with LBJ. That's why Clinton did not succeed. And that's why Obama barely succeeded with Nancy Pelosi. So that's what you need for reinvention, not just a bunch of people getting together and saying this is what you ought to do.
The HMO Act of 1973, I think it was a turning point in a couple of important senses. One of them was basically after that, you didn't hear a lot of serious discussion about national health insurance. I mean, it was basically over. And the idea of how we fix our healthcare system became a technocratic project. And I think both Emily and Michael alluded to some of the problems that you get into when you turn the technocrats loose. The reason why the HMO Act was so significant was because it was the beginning of a nearly 50-year-long, well, it's more than 50 years now, futile search for a completely re-engineered health system built around integrated delivery systems. Kaiser was the model. The idea was market forces. If we had multiple Kaisers in every market, patients could choose one of them, and then they would do all the hard work, and costs would come under control. It's interesting, as a coda to all of that, Paul Elwood, one of the people that fostered the HMO Act of 1973 and was a big advocate, founder of the Jackson Hole Group and all the rest of it, predicted that as a result of this act, there would be 10 entities in the country, supermeds, he called them, that would control all of healthcare. They'd all these little organizations roll up into bigger organizations, and then we'd have 10 supermeds. Well, it's interesting, in 50 some odd years later, we've got two. We have United Health Group and CVS Aetna that, if you put them together, are 15% of the healthcare system. And a sufficient degree of anger and backlash against that vision that one of the senior executives of United Healthcare was basically assassinated, shot in the back in cold blood in the street.